Hi, welcome to the Power of Care Spotlight. I'm Larry Moliterno with Meridian Community Care, and we're here once again with Dr. Richard DeFranco, who's our medical director here at Meridian in regards to our medication-assisted treatment program, which is specific for opiate addiction. And we all know that how severe the opiate epidemic has become in the state of Ohio. But what I find interesting is on the medical front, there's a lot of advances now in the medical field in regards to treating this disease, and especially with opiates.
Yes, one of the new things that's kind of exciting is sort of an opiate antidote that has been worked on, and they're actually using this in some areas. It's sort of an injectable dose of Narcan, which is an opiate antidote. So if you found a family member who was having an overdose, you could give them this medication and call the ambulance and sort of revive them long enough to get some expert care.
And now that's starting to become available, and I know it's going to be available even in an inhaler. And I think one of the requirements would be that you would have to go in as a family member, get some training in how to administer it. But it is something that I think could give some peace of mind, at least, to a family member who has someone suffering with an opiate addiction who maybe isn't quite ready or is not engaged in treatment.
Yeah, and I've heard some of the stories where, people have had this happen, and it would give you at least some control over those life and death situations.
Now there's some other things. I know there's some other medications even around alcohol addiction now that are coming out.
Yeah, we've been working with a camprosate, which helps alcoholics, and with people on a camprosate, it decreases cravings and also decreases the number of drinking days should they relapse. And it's very exciting medication.
Now there was an old medication before that folks used to use around alcohol that would make them basically physically sick when they tried alcohol.
There was.
And abuse, right?
Right, and abuse, and they would get very physically sick, but it was quite dangerous and could lead to some health problems. So we've pretty much stopped using that across the board.
And what else should we be looking for in terms of some other medications that we might be able to use to help with addiction?
Well, one of the most exciting things is a new shot that comes out called Vivitrol, and it's an opiate blocker. And the idea is if a patient would get a shot once a month, they wouldn't be able to get a euphoric effect. They wouldn't be able to get a high from opiates. And that's very exciting because it doesn't make them high or sick. It's not another opiate.
It is amazing to me to see just within the last few years. I mean, for a long time, methadone was one of the few things that you were really able to use to help in the treatment process, and then buprenorphine came out, or Suboxone, and now some of these other things. So it should be interesting, and we appreciate having you on board because you kind of stay up on what some of these advances are. And do you have any reasons why you think that the medical industry has kind of turned us looking for some of these alternatives?
Well, I hope the main drive is just because it's a huge health problem across the nation. I mean, more young people are dying from overdose than in motor vehicle accidents. And, almost everyone knows someone between the age of, say, 18 and 25 that's died of an overdose.
Well, and I think if we have any thing to try to make out of this opiate epidemic that we're going through right now, is that it is helping to raise awareness, because this is a drug that is so widespread now throughout our society that hopefully we can use this to raise awareness about all types of addiction and any ways that we can be able to provide assistance for folks we can. And I think it should be said, I think before we finish this up here, is that medication is just one tool in a toolbox that you have, and that there's lots of other ways to help people get better, and whatever works for you, that's what we want to do.
That's definitely true. My job is to kind of match the treatment to the patient. We've had 12-step programs for over 60 years now, and using the medications to help people get engaged in those is kind of the name of the game.
Right. So if you want more information about some of these advances in medicine, and you can get in touch with Dr. DeFranco through our website, meridiancommunitycare.org. Thanks, Doc.
Okay, thanks, Larry.